Jason Warrelmann, Director of Healthcare globally at UiPath, and we're happy to bring to you another executive review session. We do a lot of these with our healthcare customers, specifically with the executives and the Center of Excellence leaders who are driving the RPA programs just like you. Very special welcome today to NYU Langone, and today I have Suresh and Ajay with me. Maybe Suresh and Ajay, we could start with a round of introductions.
Great. Thank you, Jason. Thanks for the opportunity to participate in this interview. My name is Suresh Srinivasan, and I'm the VP and CTO at NYU Langone Health, one of the leading health systems in this country. Langone Health is one of the integrated academic medical centers with a trifold mission of taking care of patients, conducting medical research, and educating students. I joined NYU Langone Health in 2012 after long stints at American Express and Pfizer, both in New York City. In my current role, I lead several strategic groups like architecture, cybersecurity, digital solution development, enterprise quality assurance, corporate systems, innovation, and robotic process automation. Over to you, Ajay.
Hello, everyone. I'm Ajay Mansukhani, and I'm the Director for Quality Assurance and Intelligent Automation here at NYU Langone Health. I have more than 20 years experience in technology, working with global investment banks, and recently with healthcare technology. I'm actually coming close to my 5th anniversary with NYU Langone. Jason, thanks for inviting us, and happy to be here to share my experience in the intelligent automation and RPA space. Thanks.
Suresh and Ajay, thank you so much for joining us today. And I'm really excited that you're giving us this opportunity to understand a little bit more about your journey. And it's also very interesting to understand your history and your background. We get a lot of questions about, should I go out and find people of healthcare driving digital transformation, or should I find people driving digital transformation and bring them into healthcare? And I think from your both point of view, you have that view that is industrial, bring it from other organizations into healthcare because it works. It doesn't matter if it's healthcare. And sometimes that point of view brings better transformation, better experience. Because let's face it, healthcare is about a decade behind other industries. And the question is how do they do it? And I see both of you bringing that into your program today. And I think we'll start there. Is what actually made you realize it's time to bring RPA? We always say the why now is very important. I get the shiny object, and because Gartner says you should, but for NYU Langone, what was the decision point that had both of you seeing an opportunity to start with automation?
Great question, Jason. We have been researching on process automation for the last 3-4 years through research from Gartner and other institutions. As part of quality assurance, we have implemented a couple of process automation initiatives, and we learned the benefits of automation there. The real idea of robotic process automation came in early 2020 when we implemented for a small process for revenue cycle management. And that was done, and we saw the value, and we wanted to latch onto that. And one thing we do at NYU Langone really well is whether we do innovation or capacity building, we do it to scale. So we decided, okay, now that we have the idea, we see the value, we should build that capacity and get into RPA at the enterprise level. So that is the genesis. So in short, our journey started in early 2020.
So from when you look at the journey, which was very much your crawl, right? I know that you had made a decision to really take that and then run with it. Maybe Ajay, for the audience, a little bit about how that went, how you went from crawl to walk to run, and how you really drove that implementation from day one.
Sure, thanks, Jason. So from an implementation perspective, 2 major parts to it. I'll start with tool selection. That may be the best point to start. There was some prior experience using UiPath within our world. It was already evaluated by our architecture teams, the security teams, and it worked well with some of our key technology touch points. We still did our due diligence and to check other tools, but think we then decided to keep UiPath. It was the right choice for us, absolutely. And then we went into the implementation phase. From the very beginning, we knew that we want to keep a centralized model. We want to build a competency center for this initiative. We started kind of an RFP early 2020, and we wanted to choose a strategic partner that will help us build from base up. After evaluating few options, I think we zeroed down with one of them. And then taking the experience, we wanted to start with actually socializing this idea of RPA within our world. So first of all, we work with our leadership, obviously Suresh, and our CIO, Neera, and we agreed to choose corporate services area, which is finance, supply chain, human resources, and seemed to be a very fertile ground where we could actually explore opportunities. So what we did was we went to the extent of actually doing almost like training for the business folks on what RPA is and what value we could realize from automation. We created a simple intake form on our SharePoint, and for the folks who were trained, we actually gave them the privilege, like, go ahead and pitch your ideas. No filters, no restrictions. You have an idea, you pitch it. So in a couple of weeks, we saw like 50 ideas popping into that intake. And then we had this enormous task of actually going down through the 50 ideas and seeing which ones would be the best suited for our pilot bots. So we wanted to, obviously didn't want to boil the ocean then. So we actually went ahead and chose like 2 low complexity, 2 medium, and then one we wanted to keep a complex one using AI ML process because we even wanted to explore the power of the tool. And through the development process, we worked very closely with our business teams. They were very, very involved in the whole process. And then the pilot phase was kind of coming up pretty well. I think we were very successful. We started realizing some value very early in the stage. And we wanted to then take it further from there. We socialized with other business areas. Clinical space was a big one for us, which was the most logical next step for us. We really wanted to go into that. We worked very closely with our inpatient and clinical ambulatory informatics team, showed them the benefits in what we have already achieved in these other areas. And, we wanted to pitch some ideas from that side as well. So I think we kept refining the process, and I think working lockstep with the business definitely works. Seems that the process worked very well, so the way you explained it, like, crawl to actual run, I think we achieved it in whatever I would say around 12 months time.
And I know you also invested in a partner as well. How did that play into that whole journey?
So that was the RFP process, which I said. We definitely had an implementation partner. Definitely very important to have someone get that experience, what they have done elsewhere. And again, they had processes already running elsewhere. It was a matter of kind of putting our own version to that and trying to adapt that. Obviously, every institution is different, but we still wanted to take, experience from someone who's already done this before. They may not have done it in healthcare, but we try to adapt it to the extent, and hence the corporate services area seemed to be kind of the right choice for us to start with.
Makes a lot of sense, and a lot of success there for sure. With the complexity of corporate services, and you even talked about clinical, and of course your EMR. Suresh, what were some of the best practices? We heard a really good best practice on how you get started and how you implement, and some about business best practices. What additional best practices did you find really worked for NYU in really driving the automation program?
Absolutely. Let me highlight 5 points for you, Jason. First, we have very strong technology architecture and cyber security practices. And they work very collaboratively with solution development team to build robust solutions. I think that's key in terms of collaboration within the technology space itself. And the second one is the focus on platforms. When you look at NYU Langone Health, our key strength has been on building on platforms, whether it's EMR, we have Epic for EMR, we have PeopleSoft for ERP, we have Salesforce for system of engagement, and we have Twilio for communication. So imagine these are all solid platforms on which we can innovate on. And that is another key factor. The third is very strong collaboration between business partner and the technology team. Ajay already alluded to that earlier, and that is one of the key factors. And every step of the way, they've been working very closely with us, educating them, bringing them on board, and keep them focused on the art of the possible. I think that's very key to this area. And UiPath itself has several tools that we heavily leveraged on, and that's very important for us, whether it's a workflow analysis or a code check and things of that nature. And finally, our own QA process is very robust enough, so we leverage to provide top-notch product, defect-free solutions on time. So if you look at it, it's just a combination of several factors that we applied. We applied the same thing for other solution development activities as well. In this case, it proved out to be very successful.
So we talk best practices. We tend to always walk over the most important piece, which is what challenges did you have? So I always feel like we missed that opportunity, but in this opportunity, I'd love to get your insight of what challenges you did face through this process.
Sure, I'll take that one, Jason. So challenges, high level, I'm just going to break it down: people, process, technology. The most logical way of explaining it. So people-wise, I'm sure everyone over here will agree to this. It's how do you stand up a stable resource base to kind of build this up? You may have ideas flowing into your pipeline, right? But how do you actually service this? So the resourcing piece, very important. I think having a good partner definitely becomes important. When we branched into some other areas, especially on the clinical side, we had to choose another partner as well to help us build further. And I think, I would say that challenge is ongoing. We always face attrition issues and, hot skill in the marketplace. So, that's an ongoing challenge, I would say. But, we try to hedge, we try to use our experience as leaders and try to build from our experience. So that's kind of on the people side. Process was more about, it was to a certain extent was the calibration with the business teams about what is this and how soon can we build this, and what really will we start seeing things from day one, etc. Some of it was about that calibration with business, but then was also about there were several ways of achieving a solution. Some of this could also mean that you're choosing to extend or expand the scope of your applications as well. So the process of how do you kind of end or stop software development and then incorporate RPA, that process to make it very seamless seemed to be kind of something which we had to work towards. I think, and again, we had several teams to work with: change management, security, architecture, several things to be tied up together. I think overall, I would say it just took time, and as we were working through a pilot phase, we did try to fix this at the root level. But still, I mean, some of the challenges keep coming every now and then, but I think overall we were over that hump, I would say. And about the, so I said process, people, process, and technology-wise. Technology-wise was about, choosing some of the basic things about VDI selections, persistent, non-persistent. At times, we faced issues with some of the technology, underlying technology, where we had to kind of adjust our bots based on the speed at which these applications work on certain days, certain times, etc. In another case, we had a choice which we had to make between choosing a Citrix extension from UiPath versus computer vision from UiPath. But I would say, again, this is kind of the day in the life of a software development team, which we faced, and I would say kind of over the curve at the moment. We're doing pretty well in that sense, I would say.
I think it's very important insight, and thank you, Ajay. Again, we tend to look over it, and it's very reminiscent to your point of application development, but really transformation. So anybody that's ever gone through a large-scale transformation that will last long-term, they face the same challenges, right? Where am I going to find the people? what process do I need to change, and how do I need to manage my technology stack for the long term? And I think it's comforting from other organizations that have the same challenges, but it isn't necessarily restricted to automation, is it? It's any big platform. When you brought in Epic, same challenges, right? So definitely appreciate that point of view. Maybe we can get into some fun stuff. You know, you touched some really interesting use cases in the beginning. A lot of organizations do start in the revenue cycle, and that is in your preview. But like you said, you looked at corp services, you looked at some clinical, you tried to go after, not tried, but did go after some of the, not even low-hanging fruits, but the pain areas of NYU, because you had the faith you were doing it right. So maybe you could talk a little bit about what those processes are that you've automated.
Sure. I'll perhaps go into that. So as I said earlier, like, we did target corporate services, and we wanted to go, target the low-hanging fruit over there. The pilot phase included only 5 bots. We wanted finance, human resource, corporate, supply chain included in that. So we chose 2 from human resource, 2 from supply chain, 1 from finance. And they were, I would say, low to medium complexity ones. Some of them were mere web crawlers. Some of them were our own processes through PeopleSoft, which we had to process, and they were deep into manual processing, and they stopped doing the manual processing and the bots took over. That was kind of our pilot. And then once we had these bots running, we wanted to kind of go deeper. So the clinical space, core clinical radiology space, where we started with. So we built bots on pre-authorization, worked very well. Then we started targeting some on the clinical space, some on the other billing cycle starts phase of it. We had some in-house developed AI models, and we wanted to leverage RPA and bots to take those AI models and then do business transactions, replicate human effort. So I think that's where we started working on a couple of months back. I would say pretty deep as a overall seamless process where you see the AI models run the whole processes and then spit out a result set which the bots actually consume. And again, the process works very seamless, right? The bot then takes that input and then processes the same way as a manual user would process and try to end that. I think some of this took time for Fusion, right? It was not very straightforward. But then now when we go back and see, I think we have already built that process. And again, that's an area where we want to invest further. So we are looking at other models which we will be able to leverage and try to kind of build this further. Another area which we recently explored is we wanted to look beyond the UI of the applications. So we are leveraging APIs in some of our bots. That's an area which we just started. And again, UiPath does a great job at that, enabling us for the APIs and, I would say, transforming this from a beyond the screen perspective. And then I think there's one area which we really want to work towards is leveraging attended bots for our physicians and try to see how we can relieve some of their system time, screen time, and give them some time back for other important tasks which they should be doing. And if bots can be triggered in their place to do some of the manual processing work. That's an area which we really want to go deep into.
Fantastic, AJ. And, amazing that, in a year's time, you're looking at attended automation for sure. A lot of organizations aren't quite sure about attended automation. The word attended even sounds a little odd, right? But to your point, and you really hit it home when you said focusing on clinicians and reducing that abrasion that plagues them on a daily basis, not replace the processes that plague them, but reduce the amount of manual effort in the job they have to do every day. And it all comes down to experience. And Suresh, we often talk about experience, right? So maybe a little bit about the experience so far of how the automation program has impacted both the clinician, the corporate function team, yourself, it's important, right? Even developers' experience, and of course, the impact on the patient and how it's transformed their experience as well.
Okay, no, thank you. It's a great question. Clearly, the business sees the ROI, right? When we bring any bot opportunity, they do that. And the digital workers not just replace human beings by providing 24/7 repetitive processing, and we see that. But what it does is it also releases a lot of quality time, bandwidth for these as workers to focus on a high value item, right? So I mean, that we've been seeing. Imagine we implemented the whole project. We started sometime in June 2020 in the height of pandemic. We brought all the teams together and none of us met each other in person, right? Everything happened from the get-go till now. It's all a virtual endeavor. And we have done incredibly well. And so the ROI part, the releasing bandwidth for our workforce, that we see that as both the direct and indirect benefit coming out. Last 3+ years, we have been heavily investing on the digital experience for multiple constituents. We started with patient digital experience, then branched off to clinician, then the researcher, students, and now more recently, we've been looking at workforce digital experience. So whatever Ajay talked about in terms of the bot development and the value realization, though it started at a more corporate level, it's now bleeding more into clinical. We are seeing more and more opportunities coming from the clinical space that's going to directly impact patients. And the patient experience will be a lot more real time. I mean, any interaction the patient has, the bots will support it and provide a real-time experience, and that we feel it's strongly going to enhance the experience. As Ajay said, we are slowly getting into the space. So maybe in the next 6 months, if you ask the same question, I'll be able to provide you much richer response. And so it's a matter of time.
I love that insight. Sometimes it's hard, right? I mean, the ROI you can computate, but when it impacts a larger downstream process that impacts the patient, it's sometimes hard to quantify, but you know it and you see it a part of that larger digital transformation, to your point. So just like yourself, we do see this attaching to those larger transformations as a lever you pull, right?
Yeah.
It could be the direct level, it could be an indirect lever, but knowing that it impacts something that impacts the experience of the physician, the patient, but also internal. I like how you paved that for the internal team. They've never met each other before, right? Yeah. It's given them another level of ability to work on programs that make a change, even though they can't handle the process directly. And they can see the change virtually. And of course, there's another level of job satisfaction that comes out of that. So, hearing the whole journey from start to finish and hearing about the great use cases, we talked a little bit about things that went well. We talked a little bit about some of the challenges we're driving. We get a lot of questions from executives, right? Wanting to know, what are some of the things that you experienced that you wish you could tell yourself at the beginning, or tell yourself through the middle? So Suresh, really interested to hear your thoughts on how you would present to another executive, the journey of automation and the things that they should be looking out for.
Yeah, definitely. First, you need very strong partnership, sponsorship from your leadership, right? We were so fortunate to have our CIO who saw the value in the robotic process automation, and he wanted to rapidly nurture this competency in our institution. So that is testimonial. Within 12 months, we were able to implement 20 bots. We are in production, right? I mean, that speaks for itself, and the commitment that's made from our leadership. Second, you really need to engage a competent system integrator early on. You can't do it yourself, because there are system integrators who have done this for multiple sites, and they have the competencies. So you need to engage them early on. You can learn a lot from them in terms of best practices, in terms of even platform selection, assuming you haven't done one. And so that will help you in the long run. And if you do the planning properly, building and deploying a moderately complex bot, which Ajay talked about, it's a matter of weeks. But you got to start with the right footing, with the right system integrator in place, right? That's the second one. The third one is, don't undermine architecture and cybersecurity. That should not be an afterthought. You should plan security right from the get-go. Oftentimes, institutions wonder, oh, what happens if the bot runs amok? What if it messes my ERP platform? What it does, right? So that's where security comes in. I mean, they put guardrails and make sure that the right controls are in place, and that gives you everybody some comfort. And the next item is you should develop a 12 to 18 month roadmap, right? That's very important. You may not achieve all the things that you talked about, but you have to have the game plan, but start small, like what we did. I mean, this is a very clear example. We started a very well understood processes, a couple of those processes in the corporate service area. Once we implemented, that gave us confidence, and okay, let's move on to more complex clinical processes, right? So start small, but have your plan in place so that you can march towards that goal. And finally, very strong business partner engagement is very critical. The moment you come up with an ROI, you show it to them, and they say, yeah, that's great, let's do it. But it's not easy. Bot building is complex, right? So they have to understand every nuance. So it means lots of meetings with them, educate them, and bring them on board, and collaboratively work with them. That's very important. If you don't do that, you may not be successful. So the partnership with the business is one of the key ingredients that we need to look at.
Wonderful. So what I'm hearing, just to kind of summarize it up, is of course, have a long-term roadmap, have a vision, understand how to measure the return, and most importantly, get started and make a commitment.
Yeah.
Because to your point, if you don't make a business commitment towards automation, your rate of acceleration will probably be that much smaller. 20 bots in your first year is quite the achievement. Many organizations get to 20 bots in year 2, because year 1, they're still trying to figure out how to build that governance. But with a partner, to your point, you were able to accelerate that timeline within that same year. And I know we didn't talk about what that return looks like, but rhetorically, you doubled your return in that first year. So you paid for itself and the partner in that first year. So that was all within that 12-month roadmap. So it was a perpetual paying roadmap or blueprint.
Yeah.
Excellent. With artificial intelligence built in, some really significant AI. You did some interesting things with document understanding to enable your offshore teams. So it was quite a heavy lift for you and the partners team. Excellent. So Suresh, Ajay, really appreciate the time, really excited about the journey NYU has had so far. And I think for the audience, this is a good insight into another health leader's journey into automation. And I definitely hope that you'll join me back in the future for ongoing sessions.
Jason, thank you. Thank you very much for this opportunity.
Thank you again.
Thanks, Jason. Appreciate it.